My name is Michèle Prévost. I'm a professor in civil engineering at the École Polytechnique of Montreal, and I'm the senior chairholder of the INSERC Industrial Chair on Drinking Water. The purpose was to look at the strategies that utilities can take to manage lead in drinking water systems in Canada. One of the main objectives was to conduct an epidemiological study to measure the amount of lead in the blood of young children in a Canadian city, in fact in Montreal. So 306 children were monitored and the sources of lead exposure in their homes were also measured. So we wanted to show, is it still dust, is it paint, is it water? And the study is quite interesting in terms of the results because it shows that water is a residual contributing factor to exposure, and the most important thing is to live or not live in a house with a lead service line. So utilities across the country are looking to replace these service lines, and as they repair their whole system, they go through street and they take out their part of the lead service line. That's the interesting part about this issue. When you look at a service line, half of it is usually the city side. The city can work on that side. The other half is on the owner's side. That's a private pipe. Because of this shared responsibility, in most cases, the city will replace its part, and the owner may or may not, in most cases, will not change his side of things. So a big focus of our research was to show whether this partial replacement, that's how we call it, results in any benefits or has any increased risks. Lab research, the pilot research, and the full-scale research pointed out that, one, it's not effective to lower the concentration, so it doesn't help. But in some cases, it actually makes the problem much worse. Now, utilities cannot force the replacement on the private side, so we looked at ways to mitigate that, and we looked at documenting how bad it can be. And there's a very recent paper that shows that this exposure, when you do change the half of the pipe, can lead to very large exposures and actually measurable impact on fetal death. And we know now that exposure through a service line is enough to bring you to this new target level for populational lead levels in children. So it is important for health. The findings are directly, we must address the issue of lead service lines in households. We looked at how much lead would be present in large buildings, such as schools, for example, when you don't have a lead service pipe. So this big issue about lead service pipe is off the map, but would you still get significant exposure? And to our surprise, we found a very large amount of leads in some of these buildings. It really is a problem that differs from one room to the other. The school could have 10 points where children go to drink water, 9 are fine, and the 10th is terrible. So it means that we need a decentralized sampling program that school boards will just go into schools and just measure every point where children drink and just change the fixtures. It's usually a local problem at the faucet, at the fountain, and just get rid of the source of lead. It is very important to inform your customers of those risks. If you cannot control it, if you cannot change their part of the pipe, but you must inform them of the risk associated. And we're working right now with a follow-up project to this one on how to prevent it and how to control it with treatment. But as a short version of 2 years of ongoing work, there's no easy solution, and the best solution does remain to change the two parts, the private and the public part. And there must be programs put in place to help the owners to do that.